Are you constantly having those annoying yeast infections? Then this video is for you. So in this video, I'm going to tell you how yeast infections come about, and I'm also going to tell you the reasons why it is coming back constantly for you. Hi guys, my name is Melody and I'm a registered nurse. So what are yeast infections? Yeast infections are caused by a fungi called Candida albicans. So yeast infections will cause redness, they will cause itching, and they will cause white discharge. And they often occur in areas that are warm and moist. And the vagina is one place that actually fits that description. So we are going to be talking mostly on vaginal infection with Candida today. Now, Candida albicans are found in the vagina ideally, but in a very reduced number alongside some other bacteria. So they are usually found in the vagina alongside other bacteria, and they are called normal flora. So they exist there in a very suppressed number. All these factors kind of help to maintain the balance of the pH balance of the vagina. But now, some of this, when this system is disrupted now, it means that this Candida albicans or other bacteria can begin to overgrow. So I'm going to talk about some of those factors that can cause the disruption in this whole system now. So one of the reasons why your yeast infection might keep coming back is the use of antibiotics. So if you're someone that uses antibiotics at every minor inconvenience, what these antibiotics can also do is that they go to the vagina, they kill all these other bacteria that coexist with Candida albicans. So because of those other bacteria that are gone now, it means that this fungi now that was in a very reduced number will begin to overgrow. And so when it starts to overgrow, that is when someone starts having infections, you start having those symptoms, those white thick discharge will start coming, itchy, redness, discomfort, everything will start coming. Basically, because you have killed all those bacteria that were in competition with it, it means that it has every room to begin to grow constantly. So if you are someone that uses antibiotics, make sure you use antibiotics that are prescribed. Use it for the duration that it is prescribed for. And especially if you live in Nigeria, I would always say is that you can just go to a pharmacy and then you buy yourself antibiotics and you take, and then if the symptom doesn't subside, you go back again, you buy again and you take it. So that kind of thing is what causes problems like Candida albicans. So make sure you're not taking antibiotics constantly that is not prescribed for you. Another reason is oral sex. So although yeast infection in itself is not a sexually transmitted disease, it's not like someone who has for example syphilis, that if you have sex with them you can have the infection. But for yeast infection, because Candida also can be found in the mouth, if the sexual intercourse involves the mouth coming in contact with the genitals, it means that Candida can be transferred from the mouth to the vagina. So that is how it happens with oral sex. And that reason why yeast infection can be coming back is if your immune system is very weak. So for people who are HIV positive, for people who are undergoing cancer treatment and all of that, those kind of treatment can lower your immunity. And because your immune system is lowered now, it means that all these microorganisms that were subsided, harmless, your immune system was keeping them in check, they can begin to grow and they can cause infection. That's what we call opportunistic infections. Another reason why your vaginal yeast infection may be coming back is because of douching. Now, many women will see this as a way of cleansing and keeping their vagina clean. But what it does is that it introduces water. Sometimes people also use perfumed products in their vagina. So, what this does is to disrupt the pH and the normal bacteria that are found in the vagina. And by doing this now, you are disrupting the normal balance of the vagina and increasing your risk of having a yeast infection. So, douching is not a good practice. Just wash your vulva very well and the vagina is able to cleanse itself. Another reason why someone can be having recurring yeast infection is diabetes. So for people who are diabetic, it means that they are excreting more sugar in their urine, from their saliva, from their sweat. But specifically for the urine, it means that once you excrete your urine, there's more sugar to it, and this sugar is what those candida will continue to feed on. So as they are feeding on it, they are increasing in their numbers. So people who are diabetic become more at risk of having yeast infections because of that. And the same thing also applies if you're not diabetic, but your diet is very high in sugar, carbohydrates. It means that you excrete more sugar from your urine. So another reason is wearing very tight underwears and underwears that are not breathable. Remember, these yeast infections, they kind of thrive on environment that is warm and moist. And wearing a very tight underwear that is not breathable kind of provides a very perfect environment for this yeast. So make sure that the underwears are very breathable. Make sure that they are not very, very tight, and make sure they are properly dried before you wear them again. Another reason why your yeast infection may be coming back is because you are pregnant. It is estimated that about 30% of pregnant women would have yeast infection compared to 20% of women who are not pregnant. Now, this is because during pregnancy, there is increase in estrogen. And what estrogen does during this time is that it will disrupt the pH of the vagina, which is usually slightly acidic, and also those normal flora, those normal bacteria and fungi that exist in the vagina. It throws them off, giving room for this candida to begin to grow during pregnancy. Although vaginal thrush is not very dangerous to the pregnancy itself, it's something that can be passed to the baby during vaginal delivery. So if it's something that is happening to you during the third trimester, you need to speak to your doctor. So before I finish this video, I'm going to say, for everything that I've mentioned, just avoid them and see if there will be any change in this. If you have been taking too much antibiotics, please stop taking them. If you wear those tight clothing, make sure you stop wearing those tight, non-breathable fabrics. I'm also going to say that when people have vaginal yeast infection, what they actually do is that they go and further take antibiotics. Remember, I mentioned that antibiotics can be one of the causes. So they further take antibiotics, which can kind of increase the problem instead of solving it, because this is not a bacterial infection, it's a fungal infection. But you need to know what you are treating first. So which is why if you have a vaginal infection that you don't understand, it's something that you need to find out. You need to find out, you need to go to your doctor, you need to find out what you are dealing with before you actually start taking any antibiotics at all. Don't take antibiotics if you don't know what you are dealing with. And also, yeast infection is something that can also resolve on its own after a few days. But if it is past those few days and it is giving you so much discomfort and so much concern, and you want to treat it, please don't go and take antibiotics on your own. Okay, because it's accessible to you does not mean that it is also good for you. Taking antibiotics like that can even cause antibiotic resistance, such that when you need those antibiotics to treat an actual bacterial infection, your body becomes resistant to it. So antibiotic resistance is a big deal. Anyways, let me stop talking about antibiotics. Thank you guys for watching my video. Please make sure you subscribe. Please subscribe to my channel, and I will see you in the next one. Bye bye. Please take care of yourself. No antibiotics.